But as we continue focusing on healthcare, we're also in studio with NTV's own Hellen Aura. Now, I know for a fact someone has called you Hellen Aura because we live in that time.
Aura for Aura must have really been on the occasion.
But you're a brilliant journalist. You do amazing health features that pull on the heartstrings because they speak to what we're going through outside of numbers and figures and newspaper headlines. It's real people, it's real stories. And I want to know, just from your perspective, why health was the choice for you to zone in on? Was it a personal experience that led there? Was it a gap that you saw? How did you end up, covering health?
For me, it was more about passion. Passion in the sense that at first, it was about gender and women, gender issues and health-related issues. Then gender now cuts across. So when you look at the bigger picture, when you get outside the scope of gender and you look at health, health cuts across, and it's a global issue. Politically influenced, but indeed it's a global issue. So for me, it was more about passion to be able to communicate, to be able to tell people's story, to be able to voice particular issues, and to also ask the hard questions. Why is this happening? What can be done best to avert such incidences? And how best can we be able to ensure Kenyans can be able to have access to healthcare as well?
I love that. In case anyone missed the story that you ran on Sunday night, we have clips of you and Lydia, who is a breast cancer patient, and you moved with her from Kwale all the way to Kenyatta University Teaching and Referral Hospital. Let's have a look.
Despite it being well past midnight, none of us could catch a moment of rest as we stayed vigil over Lydia, feeling powerless and unsure of what to do next. All we could do was ask the train hostess if Lydia could have a full couch to herself, hoping it would bring her some relief. By this point, other passengers began to notice. Their curiosity piqued as they saw Lydia writhing in pain. Desperate for some relief, she sank into a prostration position, explaining that it was the only stance that offered her even a brief moment of comfort amidst the agony.
Every time I see that clip, I also feel like, it's so uncomfortable. First of all, how is Lydia doing? She's still obviously struggling with the pain, right?
She is.
Yeah.
She is.
What was it like for you to see that up close? I know, you're also a person. You're a journalist. How do you kind of grapple with those truths of, I need to tell this story, but I'm also empathizing with the pain that she's in? How did you navigate that?
So for me, the reality was the night we traveled to Coast on Tuesday. On Wednesdays, when now we were to travel back with her. So on phone, we always were just talking before we got to Mombasa, before we got to Kwale. And Lydia was just telling us she's in pain, but we're not understanding the magnitude of the pain that she's talking about. Until the first time I saw her in pain was when I got to her house. That was at around 7 p.m. And for me, it was a shocking experience. Why do I say so? At that particular moment, we were rushing to go to the SGR to ensure we make it just in the nick of time. But when we get to Lydia's house, we can't see Lydia. I ask Lydia's help. She stays with her son and the help. I ask Lydia's help, where is Lydia? Akaniambia, mama ako chumbani. What's going on? Ako anahisi uchungu, hawezi mpatie tu dakika. So I didn't understand. Lydia told us she experiences pain attacks, but I never got to see one. So then the house help entered the room. She came and then she's like, Njo, she wants you to see the state that she's in. So when I entered the room, I froze because, that was the first time I got to see now what you guys were seeing on the train, what we documented on the train. And when I entered the room, because I was doing mobile journalism, I couldn't film. I just put my phone aside. And I started having balancing tears because, even talking about it gets so emotional. Yeah. I started having balancing tears because I literally saw her in that prostrate position. And I was wondering, I was so confused. What do you guys do when she's in this state? Have you given her medication? Now, I'm asking all the questions. Have you given her medication? Yeah. Mumempaka dawa, mumemfanya nini? Hey, Tumempatia dawa, tumempaka hata cream ile ya uchungu. Sasa ni kuomba tu. I was like, what do you mean? She's like, sasa ni kuomba tu. And I asked her, have you prayed? Tumeomba. I'm like, na hajamka bado? Literally. Because, so I tried to speak to her, she couldn't speak. So I'm wondering, what's going on? Then the house help tells me, hivi ndo inakuanga karibu kila siku kwa hii nyumba, hatulalangi. Anasikianga uchungu. I'm speaking in Kiswahili literally because that's how she was telling me. She was explaining it to me. Hivyo ndo inakuanga, tunaomba, hakuna kulala. Hadi asubuhi. Ikenda asubuhi, yani early in the morning, wee hours, that's when now she can catch some rest. At least to even close her eyes. And closing her eyes in that prostrate position. So I remember I had to squat. And I was just calling out, Lydia, how are you feeling? All I could hear was,
It's the pain.
She can't talk. It's pain to the extent that you can't talk. I had balancing tears and I said, you know what? You say you guys have prayed. Let's pray again. And so she's looking at me and I just told God. I became so radical in that room. And I told God, this is the point. And funny enough, after that whole encounter is when it hit me, you're supposed to be a journalist. Know, but I forgot that I was a journalist at that moment in the sense that
human.
Yes,
again.
I entered and I stepped in and I was like, you said you've prayed, let me pray now. And I stepped in and I was like, close your eyes. When we were there, the son was just playing around. He was rolling over. He's so innocent. He doesn't know anything that's happening. I told the help, close your eyes. I told Lydia, you in your pain, close your eyes. We are praying. And I became so radical in prayer and I prayed. I told God, you know that prayer for you, God tells you, pray back the word to me. And that's what I did at that particular moment. And I dared him in his word. And I was like, by the way, I've done now my part because I'm not a doctor to give her medication. I can't film her in this state because I'm also not understanding what exactly is going on. What I know now or what I can be able to do is at least pray for her. And after that, I stepped out of the room. I went and told my team, she's in so much pain, so I don't think it's appropriate for us to film her. Let's just give her a bit of space in the room because even in the how she was in terms of dressed, it was a bit, we can't invade someone's privacy.
Yeah.
So
that's a big one. Let's take a step back.
Yeah.
And just bring everybody along in this story.
Yeah.
Those who may have missed it, you may find the story on the NTV YouTube page. It's called Living on Hope. Hellen Aura did it, and it aired on Sunday night on NTV. It's about Lydia Sasanu. She's 38 years old.
Yeah.
She's a mother of a 2-year-old boy, and she's been diagnosed with stage 3 multi-negative breast cancer, right? And the story was about the journey of a cancer patient and what they go through, what they deal with. And the reason why we're deciding to highlight this story today is because this story is Lydia's, but there are very many Lydias, either battling cancer or any other disease.
Yeah.
But they face very many hurdles in their quest for just accessing healthcare. So let's start from the very beginning. Lydia, you told us in the story, was diagnosed in 2022?
2023.
2023.
Yes.
But what was that journey up to the point of diagnosis?
A lot of misdiagnosis, a lot of delay in the sense that you have to wait 2 weeks for test results to come out. Why do I say misdiagnosis? The first time she discovered her lump was back in 2022 when her son was suckling. And it's so funny how this thing works because it's her son. She says actually it's her son who helped her discover the lump. And upon telling the doctor when she went for the routine, this was just the routine pediatrician checkup, she just raised it and she said, but hey guys, in as much as I'm breastfeeding, I feel there's something in my left breast. Akaambiwa, you're a first-time mom, yeah? Stop overthinking these things. First time mom, stop overthinking this situation. She went home. I mean, when a doctor tells you you're overthinking, okay, it's a bit gaslighting, but
What kind, what kind of facility was it?
Now, that was a dispensary level facility.
Okay.
You see, because this is where you go.
So she met a nurse.
It was more of the pediatrician first that you meet with, and then now there was a nurse now she interacted with. And then being very comfortable, of course, you share with the nurse at that particular moment. So she was told she's overthinking the situation. 2 months later, the tumor grew rapidly to a size where she was saying felt like a ball that she could be able to touch outside
Right.
the left breast. She went to seek another second opinion. So going for the second opinion, that's when now the doctor, at least this one, was more observant and told her you need to go do a scan and a biopsy to be able to determine what exactly is the mass that's in your left
Was
breast.
this in the same facility?
No, this is a different facility.
How far from home?
A bit far. This is a bit farther from that facility. It was still within Kwale County, by the way, because the first one was the first one was Mvindini Dispensary, and then where she went to the child for the pediatrician routine checkup. Then now the second one was in Msambweni, when she now went to see the doctor and just say, guys, I'm feeling there's something, tell me what's going on. So this hospital now in Msambweni, when she went, she was now told, the doctor told her, oh, this could be something, let's just have a look at it. And well, now she had to be told, you need to go do another biopsy and then ultrasound to be able to determine what that is. And she had to take those results to wait a certain time because those results needed to go to the lab.
Yeah.
Now, this is another thing. Once those results went to the lab, it's so funny because she says it's the lab technician who did tell her, madam, hii inakuanga kawaida. Unajua kwanza ukiwa na mask kama hiyo, alafu hiyo mask ikuwe tu iko na maji ndani, utakuwa sawa. Hata wanawake wengi wanaishi nayo na wako sawa. You know. So, number one, the first encounter of a healthcare tells you you're overthinking. Number two, the second healthcare provider tells you it's probably nothing. Don't. Just
People live with with similar masses.
Yes.
Right.
Now, when the results came back, she was told that it was not a cancerous tumor. It did had fluid inside. Yeah. So she needed to do fine needle FNA.
Okay.
Yeah. So what that procedure is, they need to pull out the liquid from the lump that they inject. It's like a needle. Then now the fluid is pulled out, and then that's when she said it felt like a sense of relief for her. But now you see, once the fluid is also pulled out, that fluid also needs to go for testing.
Yep.
Yeah. So I feel like for her, when she was told it's okay, she really didn't bother much about. I'm feeling okay now. The pain and the discomfort has eased, so now I'm back to normal. So now, upon going now for results, because she did say now, at some point she was like, but they need to go find out what these results are saying. That's when now she went and found out. Now she met the doctor. The doctor said, what we are seeing, it's not anything of concern. But if this lump continues to stay, it could become cancerous. Right now, it's not cancerous from what the results are saying, but it could indeed be cancerous.
Okay.
So this now would require you to go do a lumpectomy. And now that's when she was referred to Coast General Hospital. Because according to her, she said, when she had lumpectomy, she knew this is surgery. So she asked the doctor all options available. Is it something that would hinder her from breastfeeding? And at that time, she was told, no, you can still continue breastfeeding. We've not established anything that could be able to interfere the whole breastfeeding process. Now, this whole period, she gets to Coast General in April. When she gets to Coast General, she comes with the results from Msambweni, where she did the whole FNA, and they concluded she needed a lumpectomy.
Yep.
Getting to Coast General, they tell her, okay, cool, you've come with your results, but now we need to start doing our own results. We need to start the whole process and say,
Again.
yes. And feedback that did come from this story from a lot of patients was the fact that they've also experienced such similar instances where they come with a particular referral from this facility or results, and that particular now facility says we need now to start doing our own investigation, or rather to conduct our own tests.
Yeah.
What does that mean for a patient generally? That means that a patient would have now to start the whole process again, payment process again. They'll have to wait
and
again.
time.
Yes.
Especially when something is as time sensitive as a tumor that's growing
Yes.
and evolving. By the time you start the testing process again, that is time lost as far as treatment is concerned. Right.
Yes.
So she gets now to the referral hospital. They start this process all over again. So I'm assuming they do another biopsy.
Yes.
Okay.
Yes.
What do they find?
Now, what's funny is she now did tell me the oncologist who attended to her at Coast General Hospital, because she did compare how she was being attended to at Coast General to KUT TRRH, and she's saying even the technology that she found here is a bit different than what they have on the other end. And for her, it was just the oncologist self-examining by hand A procedure is supposed to say you need to use the digital system to be able to examine a patient. But she did say, what did the doctor do? This particular instance, he just touched her breast just round and was just like, just determining it, you know. And for her, she's wondering, okay, this is the first time I'm experiencing this. Is this how it's done?
Yeah, so no explanation on what the procedure is. Okay.
Now, after that, she does go to the breast clinic. Now, the breast clinic is, of course, where she goes through all that. But one thing that she did mention is in Coast General, she did find a lot of delays. Delays in the sense that when the oncologist tells you you need to book in to be able to see me, because also a lot of patients do stream in. But now her challenge was, she was saying the reception of the people at the reception in terms of those who are supposed to handle you booking. Because you can find sometimes you've been booked and overbooked. So you can be told to go back home. Now, let me just put it short. Lydia spent between April and October in Coast General back and forth. Now, in Coast General, she was told she needs to do a PET scan. Coast General does not have a PET scan machine. Limited hospitals have PET scan machines in this country when it comes to cancer. So she had to go to Aga Khan to do a PET scan machine. Paid 75,000 Kenya shillings out of pocket for the PET scan.
Yep.
Coming back, they tell her, okay, you know what? Now, before actually going to do a PET scan, let me just revert back a bit. Lydia was scheduled to go for surgery sometime in September.
Yeah.
So let's say between April and October, this is her period that she's spending in Coast General Hospital. She's gone for, when they discover all these things, of course, there's a particular treatments that you go through. Now, in September is when she was supposed to go through her first surgery. That was in Coast General. When Lydia was scheduled to go to theatre for the surgery, because at this time her breast was really swollen and the lump was on, it was really, you could see. She said the surgery didn't even last 6 minutes. She was wheeled out because another doctor, a female doctor, came in. So, because she's saying she didn't enter theatre out wheeled. Yeah, she was not wheeled in, like she was walking because she was still conscious. So this lady comes and asks and looks at her breast, examines it. She's like, who's your doctor? Who's been attending to you? So Lydia is saying, this particular doctor. She's like, okay. Hi. She went and had a small kamkunji with the doctors. Apparently they came and then they started examining her breast. And that's how they concluded then and there she couldn't continue with surgery. Her doctor, who was walking the journey with her in Coast General, had to apologize to her and tell her, I'm sorry, we may need you to go back and do another ultrasound biopsy because we have missed a few things. It means if Lydia did proceed with that surgery, it could have ended up fatal. So she actually says she never met that lady doctor who came to assess her. For her, according to Lydia, that lady doctor is an angel to her. So she's like, I've never seen her in my life, but she saw me, she saw the lump, and she said, no, this is not a surgery case. So once she did go to do the biopsy, then now the doctor now came. After the results, of course, delayed a bit, and then she had to go back. The doctor told her, unfortunately, your cancer is growing at a very rapid speed,
right,
43%, and it was diagnosed at that time, she was at stage 3. What did that mean for her? She needed to go through chemo before surgery. So imagine...
I think when I listen to this story, several things are popping out my head.
Yeah.
Number one, and that's why I was very insistent on at what point was she going to a facility, who was she meeting?
Yeah.
It's that journey, because you start from home, you go to your nearest health facility. Are you going to your nearest health facility that then is able to see that there's something that needs to be addressed? And when at the multiple stages that you go through, are the health facilities well equipped? Are the medics well equipped to actually be able to tell what's going on at this particular case, at this particular instant? Are you able to get the support that you need? She had to go and do some tests in a private facility and cough out a lot of money. How do you afford that at that point? Are you getting the kind of psychosocial support that you require throughout this journey in just the basics, getting to understand, or a professional telling you, this is what we think, this is what we are working with, this is where we are heading. You know, just for you to know, this is the journey we are walking. And it brings in, today is World Cancer Day. It brings in this whole conversation about cancer patients, and what they go through.
Yeah.
From that moment when you feel something, or from that moment when you check into the first health facility, to the moment when you're diagnosed, and then from there, when you start your treatment, that journey, there are very many things at play.
There's so many glaring gaps. And I'm
Yeah.
also thinking about Lydia,
Yeah.
probably being among the minority of patients who pursued her case. Because remember, at some point, you're either exhausted
Yes.
Yep.
or you run out of money.
Yes.
Hearing you talk about her, she was she really persisted to make sure I take every step, raise whatever money I can,
Yes.
assuming that she had to. I don't know how she accessed her funds.
Yeah.
But I think another glaring gap is, I believe she's a minority of the patients. Most of the time you hear, I went to one, they basically get to stage 1, stage 2 in terms of the process
Yes.
for access to health service, and then they can't go on. We've seen a lot of medical camps, the free ones, where that's what they'll say. Some of them are in such bad condition, whether it's for cancer screenings, which maybe again go on to being medical camps, and they all say, I couldn't go through with it. I was sent back and forth. They were not telling me what was wrong. They were not telling me what I needed to come with. And so where do you even begin to draw the line with what needs to be addressed first? Because there's so many other Lydias watching this right
Yes.
now, and I
Yep.
hope people can share in their experiences, whether as a patient, a caregiver, a partner, a medic. Please just send your information and engage with us on social media, because we really, really, really need to get into that. Was there anything that you needed to?
No,
to-
just before we go on break, and we'll come back and check in on and Lydia and continue this conversation.
Okay.
But I think there's also a space for conversation around medical advocacy. It's something global that's we realize when your parents say you don't go to the hospital alone. You need someone to champion for you consistently, because sometimes even the best of systems can fail you. But we'll get back into that. Of course, hashtag is Fixing the Nation NTV. You can send us your videos on 0112 500 400. And of course, we're live on TikTok, we're live on YouTube, we're live on NTV Kenya website, basically on NTV as well, and Nation FM, anywhere with a signal. We'll be back in a bit.
The issue of screening for cancer is talked about by healthcare professionals all the time, but how do we understand it? The healthcare workers, when you go into that first facility and you say, I'm feeling this and the other, how do they react? How well equipped are they with information? The clinical officer or the nurse that you'll find at the local dispensary, or at level 2, level 3, you'll find a clinical officer before you start finding doctors in the higher levels. How well equipped are they with information, even with labs and functional labs, so that they can start dealing with it? This is what universal health coverage is all about. It is starting from preventive, promotive, and that's where screening comes in.
Exactly.
To starting those primary, you go to your local nearest facility, and that's where they say, all right, we've noticed this. We'd like to refer you to somebody who has greater experience, more specialty. So by the time you're meeting a super specialist, you've gone through all these, but quickly. Somebody can already see this one, let's go straight to level 5, and I refer you to level 5. But
And screening has been, it's so effective. I don't know that we talk about screening enough. I think it's one of those words that you hear thrown around. It's life-saving in many cases. It's something you can do. You can do breast self-checks, for example, for breast cancer, because that's one of the biggest killers of women, not just in Kenya, but in the world. And so there's a way that we continue to undermine the crisis of cancer, I think, in this country, from access to information. The way you said, it's preventative. These are things that you could do, but we're very reactive, and then we're short-staffed, and the misdiagnoses that continue to go on. And I don't know how we can progress conversations on access to healthcare when it comes to cancer. I don't know what we can do other than the marches that we do, the fundraisers that we do. I feel like there's a huge misinformation, or maybe lack of access to information to those who need it the most. Something is amiss, because what Lydia went through, and as I mentioned, there's many Lydias in that story, is something that keeps repeating itself. There's a cycle there, so I don't know where it lands.
How we bridge that gap. And you're right, because the diseases we've had success in almost eradicating or treating or reducing the fatality levels are especially communicable diseases or easy to pinpoint and and treat and do 1, 2, 3. If you're talking about malaria, it's a mosquito net. If you're talking about TB, iko na tiba na tunajua. If it's HIV, we found drugs. We've talked about sexual abstinence. So because cancer is such a giant that's misunderstood, not even misunderstood, hard to understand, hard to comprehend, not easy to trace the causes, etc. You could say it's environmental, it's genetic, it's none, it's a combination of everything. Then no one knows where to start the attack from, because I can't tell you eat healthy and do this and guaranteed you will be cancer free.
True to it. I'd like to add on to your point, Janet. What can we do? We launched over 100,000 community health promoters. Why can't we start there? Why can't we inform community health promoters how to be able to ensure those on the ground or grassroots level can be able even to identify such instances of probably a lump? Let me tell you why. When you first discover cancer, the reason why it's called non-communicable, it's not painful. The lump doesn't start as a painful mass. It starts as something so small that you just think, yeah,
Yep.
So
Could be
for
a
you to be
pimple
told,
on-
it's just nothing. It's just nothing. It's a discomfort. It's just nothing. But then, depending on the type of cancer that it is and how it progresses, then now it becomes something tragic. Why do I say that? I spoke to 2 oncologists prior to this. One of them when I was doing this story. So one, I had an opportunity to speak with him, he's called Dr. Marek. He's an oncologist at the Aga Khan Hospital. And then the other one is Dr. Moki, the one who I did speak to, an oncoplastic breast surgeon. They noted something that's now changing in this demographic. Cancer was normally a prevalent disease for 40-year-olds and above. But now in not only Kenya, by the way, in the East African region, we are seeing a lot of cancer cases among young ladies, even below the age of 30.
Yep.
And by the time these cases are being discovered, you go to now, we have roughly 58 oncologists in the country. By the time you go see that professional, they tell you, hey, my dear, I'm sorry, lakini, hapa, you're at this stage,
Yep.
because you missed the whole diagnosis throughout. And then the other thing that they did point out was this particular cancer that's being detected among the younger generation or the younger demographic is proving to be aggressive, extremely aggressive. So I do understand that, yes, genetics play a role, lifestyle plays a role, but most importantly, these small conversations that we have, self-test, I feel like it's time, even if we should have brought an oncologist on set to even just show us, this is how you self-test,
Yes.
just how you can test yourself, and so that, because there are those lumps, of course, during that come before a woman's period, harmless. Or during, probably towards the end.
Puberty
An
at some
oncologist
point.
probably will talk best about that. And then there are those ones now that would be very predominant and would now end up being cancerous. Not every lump detected, by the way, is cancerous. That's one
Yep.
thing that also we need to make clear. So why don't we start these things? Well,
I'm glad you've brought it up.
Yeah.
Barbara Kariuki says what a disgrace is that. What's a disgrace is that most cancers are diagnosed at stage 3, which is why we have such a high death incidence.
Yeah.
If we could diagnose it earlier stages, we'd have more remissions. And even the Oncologists Association, and we'll be having these conversations with these specialists as well, who'll just come here and let's talk cancer with a cancer doctor.
Yes.
And different types of cancers and all. But you talked about CHPs.
Yes.
This is the structure of our health system in Kenya. It starts from level 1, goes to level 6.
Yes.
Level 1 is a community health promoter.
True.
And yes, the government got it right, the idea that, we need to start then those people who, and they used to be there. They used to be the health officers who, just making home visits. And the over 1,000 health promoters who have been employed, there's a whole issue, and we talked with Dr. Teller about it, who owns them, who is paying them, and all.
Yeah.
But that's what they're supposed to. They're supposed to be very well equipped to come to homes and just sensitize people. It's important to do screening,
Yes.
self-testing,
Yes.
and so there are all these clinics that are done for screening. Where can you do the screening? When there's screening happening. So that's the first level. When you start then going into level 2, level 3 in the dispensaries, then you're finding people who are waiting and asking you, when did you last do a self-test?
Yeah.
Have you ever done a cancer screening? Any. If it's a man, have you ever done prostate cancer screening? If it's a woman, have you ever done a cervical?
Have
But
you
then,
gotten
Latif,
your
don't
HPV
forget
vaccine?
also
But there's
men.
just the breast cancer. Even for breast cancer for men.
Yes.
When have you ever done this? Just creating that awareness as a community and a society that it becomes a big issue.
Yes.
How can we fix it? We start from there. We start from all of us understanding that it's something that needs to be done. We all of us then understand that the more community health promoters we have, and the better equipped they are, then we are dealing with the preventive promotive aspect.
Right.
If we look at our local dispensaries and know that if I go to that local dispensary, the nurse that I'm going to find there, the clinical officer that I find at a local dispensary at a level 2 or 3, that clinical officer has everything that they need.
And all the knowledge as well.
Because social health authority is structured in such a way that those level 2s and level 3s should do those basic tests.
Yes.
If you come in here and you find a lab that is functioning, and so how we do it is by, first of all, knowing that this is how the structure is. And then we start looking critically and asking, so in my county, how much money has gone to my local health facility?
Right.
At the national level, how much money is going to my local health facility? Why is the national government doing a 200 billion shilling budget if my local health facility does not have the simple test kits?
And we should be able to ask those questions. And I don't know if I'll be able to say it again, but honestly, this is also an ask to people who are watching, people who are listening. Don't undermine what self-checks can do. I think there's a lot of stigma attached to them. Screenings, if you have information, sometimes screenings are done for free in various hospitals on certain days. Please don't undermine the message that you can also begin to do the self-check, because it could go a long way in what happens next. But yeah, Maria.
I agree. No, you were getting into it, and I was just what you said about the screenings. On World Cancer Day today, there's several facilities that are offering free screenings. So in case there's something that's been not sitting right with you, this is the time to take advantage, because I know the cost can be so prohibitive for a lot of us. But go on, Hellen.
Latif, I agree with your point, because with the new social health authority system, we're now working with a referral system. You can't jump from level 1 to level 6.
Yeah.
There needs to be referrals along the way for you to get there.
So
you see,
just to clarify, there is no situation where at level 2 that provider could just be like, immediately, there's no need for me to refer you 3-4, you need to go to level 6.
now it depends on your particular condition and what it is. Then they'll
The
know.
point is
they'll
you
be able
don't
to-
just check into level 5.
I can't
from
walk
home.
into
Okay.
Kenyatta National Hospital and say, "What's up, guys? I'm here." Yeah,
Okay.
no.
Okay.
So the other thing also that needs to come out clear is the fact that now, when we have this whole referral system, and this is the 4th time we're trying to implement universal health coverage, by the way. So one of the major key things and major key issues that is now still within, especially even in that particular dispensary level, the lower levels before we get to the higher levels, is lack of adequate human resource. It's a major issue. So sometimes you either find a facility, they're too overwhelmed or understaffed. Now, that becomes an issue. Nilienda hii hospitali, sikupata wale madaktari nilikuwa nataka. Nikakaa tu. That's time wasted, delay. You go to another hospital. If you're curious enough, you go to another facility to say, "Hey, let me just go check." So that's where even the lady who has chimed into the conversation and said, once you go to a proper and get a proper diagnosis, you're at level 3, stage 3, sorry.
Right.
Yeah.
And that's already time that could have been saved, and of course treatment could have begun much earlier had there not been these gaps in the system.
Yes.
But from a journalist perspective, because you get to speak to patients, you speak to doctors, you speak to duty bearers in government, etc., what are the biggest gaps that you see as far as specifically our cancer awareness, one, and our response as a nation? Because I think at this stage we do need to be talking about it as a nation. It's not like it's one of the biggest killers for women, for men, especially those under the age of 40, and it's becoming bigger and bigger every day.
So one of the things that we do lack as a country is lack of data. We don't have to depend on GlobeCan to give us data about Kenya. Why can't we say, let's stand 10 toes on business and now start churning out our own data? Why is it that we're now having an increase in esophageal cancer, colon cancer? What is changing? Because predominantly among women, breast cancer, cervical cancer, leading death, cervical cancer, men, prostate cancer, and then esophageal cancer. But now we're starting to see other cancers crop up. What is happening? What is it that we're missing that maybe now we could be able to diagnose better? Why is it that this particular region in this country is testing more positive for a particular type of cancer than another particular region?
Right.
So we need to understand also the underlying factors other than waiting and saying, we have increasing cancer cases in the country. How best can we equip our medical health providers in the country to ensure that, yes, we're dreaming or desiring to be a destination, a tourism hub destination, but we have everything in place. The reason why KU is now well known for cancer treatment is they've marketed themselves as a cancer treatment hub. But are we still there yet? You know why I ask that? If you still go to Kenyans who are suffering from cancer on the ground, in the back of their heads, daktari akiniambia hivi, I'm going to go to India. But they don't have the money to go to India. We're saying, instead of taking that money to India, bring it to our facilities, we treat you. But the queues that are there, for you to even get a particular surgery, you're told, we've booked you, we're in February. We can book you in and slot you for surgery probably in the next 2 months. Do you have 2 months?
No.
Yeah.
It's a whole mix in this, and we'd like to hear from you. Just you can call in on the number that's on the screen, 0719-038-858. That's 0719-038-858. Let's hear from you, your experience and your perspective, your experience on issues of cancer and cancer treatment, cancer diagnosis, cancer screening, and what we need to fix. What's your own perspective of it? Maybe from your own personal perspective. You've gone through it. You're a caregiver. You're a doctor. You're a medic. Wherever you're working, you're a community health promoter. What is it that you see in the community? How do we need to fix this whole issue? You talked about data, and there's an institute called the National Cancer Institute that was established in Kenya.
Yes.
And it's supposed now to be like, the repository of information about cancer.
True. And
all the work that's being done. They've taken a long time just to get that data going and the data working. And we'll bring them here as well and ask them, so you have been in office for a couple of years now. Where is our data? How do we know where the prevalence rates are high for this particular type of cancer? If it's esophageal cancer and there are parts of the Rift Valley where this is highly prevalent, why? What's the causes? Who's working on that research on it? Even KU, Teaching and Referral Hospital, we bring them here and ask them, you've been doing a lot of this research on cancer, because that's what they do as well. What are you finding and what do we need to do? So this is all that we'll be asking you to do. Just share your experience with us, and you can also share that on our social media platforms, on YouTube and Facebook, NTV Kenya. We have Samuel on the line. Samuel, good morning. You are calling us from Moranga. Good morning, Samuel.
Morning.
Thank you very much for calling, Samuel. What's your experience with cancer?
I have a very serious experience with cancer.
Go ahead, tell us.
I have a very serious experience with cancer.
Yes.
My mother-in-law.
Yep, she's currently going through treatment.
No, she actually passed on several years ago.
Mm-hmm.
And we took our dear mom to several hospitals. And when we were in all the ignorance we experienced, because we take our mom, we told we have this, we don't have this, we don't have a professional who would actually assist us. Now you can imagine I had my sisters in love who would assist me taking mom from one hospital to another.
Yeah.
I'm a board member in Kijabi Hospital.
Mm-hmm.
My mother-in-law told me, take me the hospital where you are a board member, because she knew I was a board member in Kijabi Hospital.
Yeah.
The specimen were taken to Nairobi, then coming back. You can imagine all this process, waiting, somebody who is crying. Can you imagine your mother-in-law who is crying on your hand?
Yeah.
She had reached stage 3, proceeding to stage 4. Now, before she was treated, we took her to several. I don't want to mention the names of the hospitals, but it's the names of the facilities where we took them. And all the officers, the medical practitioners, we went. They would not tell us the truth. They would tell us, we want to check this, we want to check this. Then operation was conducted in Kijade, and then after opening our dear mom said, the level that she has reached, it is beyond treatment. It closed, and then we were taken for palliative care in Nyahururu. Where we took our mom. Can you imagine the movement from where our home is used to use out of us? Somebody who had gone for operation.
Yeah.
Somebody who was close back is saying that we cannot keep it anymore. That is what happened. They told us, they called me, my dear sisters, and our dear counselor, the family counselor, and one of our pastors. And then we talked and they told us, the message we have gotten from the medical practitioner is that the level that your dear mom have reached, she cannot go beyond 1 year. It is 6 months, 1 year. And I tell you exactly, 12 months and 1 month, that is 13 months, dear mom passed.
She passed away. That's a painful one, Reverend.
All the processes, if the hospitals that our dear mom had gone to, dispensary, level 3, level 4, to when we took her to Kijabe. When we took her to Kijabe, she was actually helpless. For sure, they had to take price. So, as the sister said, our sister in Kwale.
Reverend Samuel, I thank you very much for sharing your story, and thank you for calling in this morning. We had a problem with the line, but at least we got the gist of it. It's a whole journey, and this is what we're talking about.
Right.
It's a long journey of starting from the moment that you start feeling sick, to the moment you're diagnosed, to the moment then you start treatment, and the cancer is progressing. It's not taking a break and saying, okay, I'm giving you 2 weeks, go to hospital and come back. I mean, it's progressing. Now, it looks at our structure of our health system and how we fix it in such a way that then it addresses this need. There are a growing number of cancer cases in the country.
True.
Doctors are agreeing on this. Is the Ministry of Health hearing it? Are the governors hearing it? What are we doing, even as we roll out universal healthcare, to make sure that we are addressing this at the local level? And these are the conversations we'll be having, even as we bring in the National Cancer Institute, the Ministry of Health, or the Council of Governors, or any governor, or doctors to come. We'll be asking, how are we structured so that we can deal with this, even going forward? How are we structured, even in costs?
True.
Because, like Dr. Davji was mentioning here earlier, and his big beef with SHA is the referral system, especially for outpatient. And he says, you need to go, outpatient services need to be handled at a primary healthcare level. But the primary healthcare facilities, are they well equipped to actually sort this out?
No.
Do we have information at the community level that tells you, now, by the way, before you go to level 4, which as a sub-county hospital, first start with dispensary. And dispensary is well sorted, well equipped to address a lot of many gaps that we must fix.
Yeah, but we really thank you for just pouring your heart into that story. We really just wish Lydia the best and many like her, but just as we've said, it just comes down to communication and awareness and being relentless in our pursuit of knowledge and wanting to be treated, which, like I said, I give Lydia so many props. That must have exhausted her, but not many have that kind of resilience. As a relative very close to me, I've seen the journey of misdiagnosis to being diagnosed, and then you have to travel and figure out how you'll do it because you're misdiagnosed twice here. So it's a journey, and like I said, there's almost everybody knows somebody or is one person away from somebody who is being affected by cancer. So definitely need to bring those conversations back to the studio.
Yeah, agree. Thank you so much, Hellen, for the work you're doing, I think it's amazing coverage, and not just on cancer, on healthcare as a whole. And I'm also sending a lot of love and a lot of grace to you. I know it's not easy to walk journeys with people, and as a human being, I can see it, and I'm so proud of you. You're doing amazing, and I also hope you're getting like the psychosocial support to be able to do the work that's necessary.
Thank you. I really appreciate the love and encouragement from fixers of the nation.
Well, fixers. Everybody's a fixer. Now we're going to a conversation on fixing our money problems.
Yeah.
Yes.
There's a lot to fix, guys. There's a lot
Yeah.
to fix. We'll be
But
back after the break, but thank you so much, Hellen.
Thank you. Thank
Just
you so
Ivy
much.
joins us after the break. I want to talk about our money habits. Okay, so what's our relationship with money?
I'm already guilty. I've already done this and that.
I've already seen some
No one has even
conversations
said
online,
anything,
you
you're
know,
just
on what happens, and we'll start with those conversations. So keep it here. Just Ivy Africa joining us. She's the founder of the Movers Society, and she'll be joining the Fixer Society shortly.